Hi, so we're back talking about the cervical spine today, and primarily in this discussion I wanted to talk about injections and the process of getting an injection. Here at First Aid Spine, we take a lot of pride in being a cervical spine center of excellence, and we do a lot of injections. And our focus here is to keep our patients comfortable during the injections and minimize the anxiety in terms of during the process of getting an injection. How do we do this? Primarily, you come in through the front door of our center, you sign in at the front desk. Somebody will bring you back to a special suite that is designed to give a comfortable and anxiety-free injection. You will change from your regular clothes to a gown. You're typically given some medication in order to get you nice and relaxed and relieve any of the anxiety you have, and also to start to prepare you for the injection process in general. You're then brought back to an operating room suite that is sterile, where your interventional pain management specialist will be waiting there for you. He will place you in the proper position on the procedure table in order to receive the injection, and he'll use X-ray in order to localize the proper area for the injection. At that point, you may be given some more medication to help with the sedation process and to decrease your recollection of the injections. The amount of sedation you get is dependent on how much anxiety you have and how little you want to remember about what's going on. In general, the injections are comfortable. They're guided by X-ray in order to make them safe and effective for you, and they could be given in different areas of the neck. Sometimes if a patient comes in, as we've talked about in earlier segments, with mostly arm pain, which we know could be a sign of nerve pressure in the neck, the injection could be done around the nerve, which is called a selective nerve root block. In this type of injection, your pain management specialist will guide a needle with the help of X-ray right into the area around the nerve. That'll help decrease the inflammation on the nerve and could help significantly reduce the pressure around the nerve, giving you less arm pain. Other injections in the neck could be done more for the area around the spinal cord itself in a more generalized area. The injection could be given from the back of the neck, and it could go directly between the openings between the bones in the neck. That's called an epidural injection, and the medication would travel up and down around the spinal cord and the nerves in a disc to give a more generalized form of neck relief. Further injections could be given in the joints in the neck, as you see in the back. These are the areas that move when you bend forward and back. That could relieve pain in the neck itself, and also pain that could shoot down between the shoulder blades or into the trapezial regions. So depending on where you have symptoms in your neck, will help your doctor and your interventional pain management specialist guide which injection you should receive. And the process here at First Aid Spine makes sure that you get your injection with as much comfort as possible and as little anxiety as possible. Thanks for your time. Tune in next week where we'll discuss more about the cervical spine.